Hey strangers, so I was just gonna make a quick video about my experience at my first appointment slash two appointments with KMH. So yeah, just letting you know how that went. To be honest, I'm a bit hesitant making this video just because like I have like some weird paranoia in the back of my head that like the people at KMH are gonna somehow like find this video and it's gonna affect my assessment. I don't know. Hopefully not. um, but basically, yeah, I had been on the wait list for 2.5 years to get in for a top surgery assessment for like OHIP funding for my surgery, and and yeah, so I got a call. I'd been hounding them, like calling every 3 months, and they kept saying that it was going to be longer and longer on the wait list. And then I called again, and I finally got a call back saying that they were scheduling a triage phone call for me, which is basically like the first phone call where they ask me some questions and then they book my initial assessment. And then on the morning that I was supposed to get that, that was on Monday, they called and said that there was a cancellation and that they actually just wanted to bring me straight in for my first assessment, which is great. And so I went in for my first assessment Tuesday. I had my first appointment at 10:30, and then I had my second appointment at 1 o'clock. And so my first appointment was with a psychiatrist there. I was planning on voice recording the meetings, but I kind of like get flustered in actual situations, so I didn't record any of it. But basically, like the first appointment was very intimidating because they were asking me a lot of questions about my mental health in a very like kind of like interrogating kind of way because unfortunately and stupidly enough I didn't think about this, but as I talked about kind of in my last video, I've had a lot of like stress going on in my life over the past 6 months, financially and with my uncle dying and my aunt in the hospital and my parents out of the country and school and a lot of stuff going on. So I was not in a good place mental health wise because of all of that. And then with my uncle dying and then my aunt being hospitalized a couple days later while my parents were out of the country, I kind of like couldn't handle that. And I had like a little bit of like an emotional meltdown and wound up going to the CAMH emergency room, which is like the it's like the mental health emergency, I guess, in Toronto, because I thought that if if I just like went inpatient for a while, then it would like give me some time to like sort out my life, and I could also like get a note from KMH that I could give to my school, which would help me get like course extensions since I had missed so many classes and I didn't really have a medical note for it, even though the reasons I had missed class were due to like my physical and mental health. And so that was my plan. And then when I went in to the emergency room, I kind of disclosed a lot of stuff to them about my previous hospitalizations when I was in high school, and also like the fact that I had had like a previous diagnosis with BPD and bipolar. They weren't really like sure what it was, and so I wanted to get like properly reassessed for those things. And because I didn't wind up going inpatient, I thought that that wouldn't be on their records, which is stupid. If you ever have any involvement in KMH, that is totally on their records, and they totally will ask you about it. So it was kind of like interrogation-y when I went in there, and they were like asking me a bunch of questions, and like, so like you have a history of like BPD diagnosis and all these things, and that terrified me because when I first went in to get hormone therapy with my first gender therapist, who was absolutely fucking terrible, he said that he didn't think that I could go on hormones because I had a BPD diagnosis, which is bullshit. If anyone tells you that, they're fucking wrong. Like that's BPD has nothing to do with your gender identity, and obviously neither does bipolar. So, like, it's anyway. I got really freaked out when they were asking me all those questions about that because I thought that it was going to be like points against me for getting approved. But I kind of wound up like backtracking a lot and being like, well, like I don't really have like I was just in CBT for like panic disorder and agoraphobia and like social anxiety, and I don't really have like that's kind of like a historical diagnosis, and I haven't been reassessed for it, and like my life's been like pretty okay since I came out, other than like recent mental health stuff. I'm like really kind of downplaying my mental health issues, and I feel like she might have been like sketched out by that because I was like backtracking on a lot of the stuff that I had told to the like psychologist or psychiatrist. But in fairness, like I was just like in a really bad place. Like obviously I'm not of like totally sound mental health, and I do have some like ongoing issues, but I was like in a really bad place when I went in to speak to the psychiatrist, and so like I feel like I kind of like might have like overstated things in that situation, but I'm really worried that that is going to like affect my assessment. I don't know. As far as like my gender identity, I didn't really talk to them about non-binary stuff. Like I said, like I identified as transmasculine and stuff like that, and I'm pretty much just trying to say whatever I need to say to get through the assessment quickly. I wrote a whole article about my decision to do that, that I'll link to in the description, about how I originally was going to go in and talk all about like this like non-binary and genderqueer stuff, and then I realized like my physical health is so dependent on me getting surgery because of my chronic pain and problems that I'm having with my teeth and jaw. Like I'm not able to wear a binder, and I'm slouching all the time, and it's really like affecting my health. And so it's really important for me to just get through this process as quickly as painlessly as possible. So I chose to not go into this from the position of like being an advocate and stuff like that. I was just gonna like make note of the progress and then comment on it afterwards, rather than possibly delay my treatment and assessment and approval, um, by you know complicating my gender identity to them. And I don't think it's really like important. Like the reason that I'm going in there just to get top surgery, like I have dysphoria and like all of these things, and so I basically just tried to like focus on that. And so I think like as far as a conversation about my actual gender identity and my history with my gender identity, that went really well because I'm out as trans in all aspects of my life, and I have been for 4 years now, and so. And I've lived stealth before, and I've legally changed my name, and um, all of that stuff, and I have like a really good support network, both with my family and my like friends in my community. And so I really tried to focus on that because I know one of the main things that they focus on for like readiness assessment is just like whether you have people that can take care of you, and like whether like in the position that you are in your life you can handle getting a surgery right now, which I totally am with like all of my people that I have supporting me in my life right now. Like I feel like I'm in a good position to be getting surgery. But yeah, so I really tried to focus on that stuff, and I was kind of worried about the mental health stuff, but I left the meeting feeling like okay about it, especially with all the horror stories that I've heard about CAMH assessments. Like I thought like, well, it wasn't the worst way that it could have gone, I guess. And then I came back. And they asked me too, like, why I hadn't been consistently on T, and I basically just said that, um, like, I wanted to preserve my fertility, which is true, and so I'm just kind of like, doing like a few months on, a few months off, like as I see fit, and my doctor is supportive and observing that, which is true. But I didn't really talk about, wanting an androgynous figure or anything like that. Uh, because again, like I really just don't feel like it's any of their business. And yeah, so that like they were actually, I was surprised. Like I thought when I mentioned that like I wanted to maybe have kids eventually, that they would be like super weird about it, but surprisingly like they weren't weird about it. And she actually like gave me like a trans fertility survey to fill out, basically just talking about like what transition steps you've taken and what you want to take, and like your plans to have kids, and like what steps you'd be willing to take to like preserve your fertility and like have kids. And so they were actually like good about that aspect of it, which I was surprised about. And then I just like went and had lunch, and then I came back from my appointment at 1 o'clock, which went much better. I kind of almost feel like they may have like good cop bad cop to me, because the first appointment was like so intimidating and almost like an interrogation, it felt like, and then the second appointment just went like really smoothly. And the woman I was seeing, who was the psychologist, was was really nice, and she was really laid back and just asking me about like where I was in my life and what my goals were, and making sure that I had like a support network, and asking me about like how I felt I was doing like in my life in general, and had me like tell her a little bit about like my gender identity. Um, and like she seemed really positive about the whole thing and very like non-judgmental. And so I left the second appointment feeling really positive. Like I felt like I did really good in that appointment, and basically what's going to happen is I do the first appointment and the second appointment with two different people, a psychiatrist and a psychologist, and they meet up with their like assessment team and present like both of their notes and kind of like discuss my case. And so I feel like the two appointments might have like evened each other out. And then I will be getting a phone call anywhere between like 4 and 8 weeks from now to tell me basically like the results of the first assessment and what they think about the whole thing, and then booking my next appointment, which, depending on the results of the first assessment, will either be an additional assessment, which is most people have to go for multiple assessments, but in a perfect circumstance, like I could be getting called in just for my surgery readiness um, like meeting, which is basically like to approve me and book the surgery, or not book the surgery, but like to approve me and like have a talk about how the surgery is going to go, which would be like absolutely amazing if I could just go in for the one assessment and then like move on to the rest of it. And the thing is that like I did make sure to like really highlight my physical health concerns with both of the doctors, and I did make sure to like to make sure that I said like everything that I said, like I said to both of them. Like I maintained, like I didn't really lie about anything. There was just like some stuff that I didn't really feel was relevant to bring up, or I didn't want to like complicate the assessment. And I just try to like keep my story as like simple as possible. And so yeah, I feel good about it, and I feel like there is a strong chance that I won't have to have another assessment, because I did focus on like the fact that I have been doing a lot better since I came out, um, and how like my previous mental health issues were related to gender dysphoria, and how like yeah, like my physical health concerns around needing to get surgery, and how like my physical therapist and dentist have both said that like me getting top surgery, it kind of needs to be like a medical focus, because like I have chronic back and shoulder pain after I don't know if I ever talked about this. I might talk about it in another video eventually, but I shattered my collarbone when I was 19 in a skateboarding accident, and I had to. It was a really long, really messy injury that had a lot of like bullshit from doctors not treating it properly, and then it wound up healing, and then it wound up dislocating, and then I wound up having to get the bone reconstructed and plated, and then I had to get the plate removed because it was causing problems. And so I wound up having to get two surgeries over the course of 2 years after the original injury, and I'm still living with chronic shoulder, back, and arm pain, and like neck pain, and like just like my whole like upper right side is kind of fucked up. And I am going to physiotherapy for that on and off. But the fact that I can't wear a binder because of that, and I basically just like slouch all the time to try to like hide my chest, and that's like really exacerbating my pain, and I can't really like focus on my physiotherapy without being able to like maintain proper posture. But I'm not really willing to maintain proper posture until I get top surgery, because that means that I would be like sticking my chest out, which would be horrible. And so I really like highlighted to both doctors how like this is like a medical necessity for me, and they both did seem to like take that quite seriously. The only other thing that went on in the first assessment that was kind of fucked up actually was that like she was talking about like physical health and stuff like that, and I mentioned some of the like intersex stuff, and like as soon as I mentioned that, she was like, "Oh yeah, no, that is good to know, because that might like affect our assessment decision." And I was like, "Okay, cool." And like me like being really sexist, or like assuming that they're going to be really sexist, thought that me mentioning the intersex stuff would be like points towards me in the assessment, because like intersex people are more likely to be trans than dyadic people. And but yeah, if you're thinking that being intersex would help you validate your gender identity in the eyes of the medical world, you are wrong. Because I kind of asked her, I was like, wait, like, do you mean like it would affect your assessment in like a good way or like a bad way? And she was like, well, like this clinic specifically isn't really authorized to give funding for intersex related surgeries. And so, like, if you have like an intersex condition or whatever, like, there's a chance that like we wouldn't fund your top surgery or something. And I was like, what the fuck? Like, just because I'm intersex doesn't mean I'm not trans, and B, like, I've only discovered that I was intersex like over the past like 8 months. So, and I haven't had like genital reconstruction surgery or like anything like that. Like, if I just didn't find this out about myself, then I would just be going through essentially as a dyadic person. So I don't see how me knowing that about myself makes a difference. And I was kind of like really like freaked out and kind of like angry about that because it doesn't make any sense. And so then I kind of had to backtrack and I was like, whoa, like me identifying as intersex is kind of like a social identity, that I've come to on my own by discussion with other intersex people, and like no doctor has ever called me intersex, and I, wasn't born with like they didn't note like ambiguous genitalia when I was born, and I didn't have surgery, and so like it's not like, and then I kind of had to backtrack and be like, whoa, no, never mind, I'm not actually intersex, like um, and really like try to like minimize the stuff that I said, and so I felt weird because I felt like I did a lot of like backtracking in the first appointment, and I'm really worried that that might affect something. But like, how fucked up is it that they're like, oh, like we might not cover top surgery if that's an intersex related surgery, because like how the fuck would that be intersex related? Like what? I don't understand that. Like intersex people are still trans. Like I'm not like a cis intersex person that's looking to get any procedures to make myself more dyadic normative for my assigned gender. Like it's still like I don't like I didn't even really like understand what she meant by that, and so really hoping that that won't affect anything. But I kind of like really backtracked and was like, whoa, like there's nothing in my medical documents that says intersex. I just have some like weird body stuff going on, and that's yeah. So I really hope that that doesn't actually affect anything, but I guess we'll have to see. But overall, I think it went well, as well as it could have. And I guess we will just have to see how things go within the next 4 to 8 weeks. And I will keep making videos as, new information presents itself and kind of documenting this process for all of you. So, yeah, that's all I had to say. And I will talk to you later. Peace out.